This episode is brought to you by the Fertility Awareness Mastery Charting Workbook, the first beautifully designed, fully customizable paper charting workbook designed with you in mind. With 3 years worth of charting pages, the Fertility Awareness Mastery Charting Workbook has you covered. If you've been looking for a solid alternative to charting apps, you'll love this charting workbook. The FAM Charting Workbook is available in both Fahrenheit and Celsius editions and is available in spiral-bound, paperback, and ebook versions. Head over to fertilityfriday.com/workbook to order your copy today. That's fertilityfriday.com/workbook. This is the Fertility Friday podcast, episode number 455. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Workbook. I'm a certified fertility awareness educator and holistic reproductive health practitioner with over 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormone health, and optimizing the menstrual cycle without hormones. I have been consistently outspoken about hormonal birth control over the past 2 decades and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I teach women's health professionals how to utilize the menstrual cycle as a vital sign in their practices, and I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys and a brand new baby girl. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with me today. Today I'm sharing an interview all about migraines and how they are affected by the menstrual cycle, a topic that I have not specifically addressed, surprisingly, in 8 years of this podcast. So really excited to share today's episode with you. So before we jump in, let me share a little bit about my guest, Dr. Meg Mill. Dr. Mill is a functional medicine practitioner, best-selling author, podcast host, and speaker. In her virtual functional medicine practice, she works with patients worldwide to heal the root cause of their health struggles through advanced diagnostic testing and personalized support. With her 2 decades of clinical experience in conventional and functional medicine, she can help people improve their health naturally while still understanding and respecting conventional practice protocols. Meg is particularly passionate about helping people end headaches and migraines, increase energy, and restore mental clarity without drugs or overwhelming protocols with her proven E.A.T method. So without further ado, let's go ahead and jump into today's episode with Dr. Mill. And I'm really excited to be here today with Dr. Meg Mill. Welcome to the show, Dr. Mill.
Hi, thank you for having me.
Well, thank you for being here. I was telling you in the pre-chat that I'm really excited to talk about migraines. And as you were kind of getting at, it's one of those things where people don't necessarily talk about a whole bunch these days. There's a whole bunch of topics that are really kind of on the top of everyone's mind. But ironically, I would assume that one of the reasons it's not talked about is because it's so common that many people might just think it's normal, or they just have to deal with it, or whatever, or they've tried to deal with it and they haven't had success. So I would imagine that there's a whole bunch of reasons why we're not talking about it. To get us started, I would love to hear a little bit about your background. So maybe tell us a little bit about what you do and also what prompted you to kind of focus a little bit more on this area in a lot of the work that you do.
Yes. Yeah. So I'm a functional medicine practitioner and I have a virtual practice. So I see people all over the world for many different reasons in functional medicine. And what I started to notice was that I was seeing my practice is primarily women. And so before we meet together, I have everyone fill out a detailed intake questionnaire and a symptom questionnaire. So because we really dive in deep. And I started noticing this common trend that either people were coming to me for headaches and migraines, or the other thing that, like you're saying, was happening. It's so common that people were, when they were filling out these intake forms, they were marking like chronic headaches, as long as I can remember, headaches once a month, 5 times a month, every week. and they were normalizing it. Like it was so common to them. It was just such a part of their life that they weren't even thinking that that was an issue. They were coming for something else. And this was like just in their form. And so then once we started working together, everyone started saying, I can't even believe this. This changed my life. I don't have headaches anymore. My migraines are gone. I never thought I could live without migraines. Like it was just such a change and a exciting experience, because really we're not told. Like in conventional medicine, the way that we're treated is to give medication that really just only covers up pain. So it really doesn't do anything to really get to the root or fix the problem. It's just covering up the pain from the headache or migraine. And so they continue, and you're just covering the pain. You take the pain medicine, you keep moving on. And so when we work together, they would see this dramatic change in both incidence and severity of headaches. And so I started to realize that I feel like we're saying, there's a lot of people, we're luckily now talking about hormones. We're talking about gut health. We're talking about some of these things that weren't talked about, but we're not talking about the fact that people don't have to live with headaches or migraines. And I say both. I know there's different, there are different experiences, but I can see the huge change, whether you're someone who just has chronic, tension headaches, or if you're a full migraine sufferer that has hormonal issues or whatever. It's all about connecting the dots.
Mm-hmm. Well, and before we get into the migraine topic a little bit further, I think this is a good opportunity just to talk a little bit about the difference between, because you alluded to it already, conventional medicine and functional medicine. So as a functional medicine practitioner, you'd think that the majority of the listeners to this podcast are familiar, but this is a question and a topic that I often have with clients and getting into those differences. So did you want to talk a little bit about the difference between allopathic medicine and functional medicine?
Yes.
And also how your approach would be a little bit different than, say, if one of the listeners has migraines and they're going to their doctor, let's say, and they're just told to take a medication for it. And get out of my office. Here's
the medication. Here you go. So first we'll talk a little bit just about the difference in conventional and functional in general. So the conventional system is set up more for acute care, really. They're going to manage things that need the medications, that need treatment, that need to be treated acutely. But a lot of these chronic conditions, we really need to look at the connection. So in functional medicine, we're looking at the root. So, it's called root cause medicine. So we're saying like the root of the issue. I often find there's not just one root. It's not like, okay, this is the only thing, but it's actually about looking at all of those connections, all of those things that are going on within your body. So why are you getting the headaches? The headaches are a symptom of pain from something else. So we actually take it out of just the head. We actually look at the whole body, and we put all of the pieces together. So we're looking at the connections and trying to we're really diving into your whole health history. We're looking at everything that got you to where you are today. Sometimes those are even things that you wouldn't even suspect could be a factor. Then we look at your genetic makeup, and we look at everything that you have going on and put those dots together. So in conventional medicine, the way we'll move more into migraine treatment. So the way you're going to treat that is basically with a medication. So they're going to look at the headaches, and they treat often, with medication, then that what can we do to reduce your pain? So I've actually heard physicians say, well, this is just something you live with, and, that this is just a chronic thing. And as you age, so you're really kind of told, this is just who you are. And here you're going to take this medication, and that's going to cover up your pain. The problem there is, one, you're never really solving it. And two, you're also often these medications have side effects. So the side effects from the medications can actually lead to more problems. So we'll use Advil, for example, and that's just a common over the counter one. There's a lot of prescription ones too, but Advil tears the lining of your gut. So actually something that we can dive further into are one trigger for a migraine is food sensitivities, because when you have a food sensitivity, you're getting this immune response, which is causing inflammation, and that can actually lead to headaches. But the Advil can cause more food sensitivity. So while you're covering up your pain, you could be damaging your gut lining, which could cause, these other things. So we have to consider that too. And in functional medicine, we're going to flip it around, and we're going to put all the pieces together, like I said, and we're going to say, okay, all of these connections are happening. Where do we need to unravel this in order to find out where the pieces are for you uniquely that are causing your headaches?
Well, thank you for going through that. That was very succinct and really helpful, because although we can assume that the majority of listeners are familiar with this, and I think, a lot of them are, there's always a few newer listeners who are still kind of figuring this out, like, why is it that I hear this kind of stuff on your podcast and then I go to my doctor and they tell me something totally different? So hopefully that is enlightening.
Yes.
I do have a comment, which is that I can really relate to what you said about how when you have, an intake form and then your clients are filling out all this information, the migraines are just falling into the fray because something that they've had to deal with for probably either their whole lives or just quite a long time, given that it's often a chronic thing for people. I find this a similar thing with period pain, where a lot of women have experienced period pain. It's just like part of their identity. Like you said, they've tried stuff, but it hasn't made it go away or made a dent or anything. And so they just kind of assume this is just how it's going to be. And so they're coming to you for something else, and they're not even thinking about the period pain. It's just like incidental in their kind of overall picture.
Yes.
So with that said, with that comment, I feel like that's a good segue into migraines. So tell us a little bit about migraines in the general sense. So talk to us about your understanding of, what some of the causes are, maybe even describe what a migraine is and how it's different to a regular headache. And if you would like to go into it as well, I know that, in my work, because I'm looking at the cycle, migraines are often happening at certain times of the menstrual cycle, much more commonly around your period or around that time, but other people may experience them around ovulation. But at the end of the day, I think it's up to 60% of migraines women experience are related to their cycle. So, or like cyclical, if you know what I'm saying, in terms of timing.
No, absolutely. And I run a program specifically for headaches and migraines. And one of the things that we do in that program is evaluate hormones, because there is a strong connection with migraine sufferers and hormones. And so so we can let's start there. Do you want me to so basically, just in a really quick, brief way, so your tension headaches don't necessarily have patterns. They're the most common type of general headache, but they can be for many different reasons. And they don't necessarily have a pattern. They can usually feel like a band across your forehead. You can even feel that from like neck tension, things like that. Where a migraine is going to last generally a longer time. You're going to generally now they're I see them they actually come very differently for a lot of people, but generally there can be a throbbing type pain. They generally have like an aura you can have associated. There's a pattern to it. So you're looking
talk to us. Not everyone might be familiar with
aura.
The term.
So the aura can affect vision. So if you have like visual disturbances, if you have, you can have nausea and vomiting, you can have things like that. You actually, when you have a migraine, want to get to like a dark room. You can have light sensitivity. You can actually have smell sensitivity. If you feel the migraine coming on, it's nice if you can. I know if you're in the middle of work or something, you can't, but if you can actually get to a dark, quiet place and actually lay down a little bit, that can actually help the pain of a migraine, which we're not really even getting into cluster headaches, but cluster headaches are opposite. Actually, movement helps cluster headaches. So there's all sorts of different, presentations here,
well, I'm sorry to be annoying. What is a cluster headache? I always like defining things.
Yes. So that is more of,
sorry, I was just going to say, because I've experienced a couple of migraines. Ironically, it was when I was a teen and on the pill. It's the only time I've had migraines.
Yes.
But having that experience when you say aura and light sensitivity and nausea, like I've experienced that. It's horrible. A migraine just takes over your whole day. It just feels like you're in a cloud or something like that. And the pain is unrelenting. And it's a very, very intense thing. It's very different to what you described as a tension headache. But I personally I don't even know what a cluster headache is, which is why I'm asking I'm sure I'm not the only one that is not familiar.
So cluster headaches. So migraines are generally longer too. So like you can even get migraines for like 72 hours. You can get them for a while, where a cluster headache is actually a shorter period of time. And it feels like it's a very intense pain in one spot. It almost feels like you're like getting kind of jabbed in a spot, but it doesn't last long, and it actually feels better with movement, where migraines actually feel better when you don't move your head. So the more still you can be, you actually have less pain potentially with the migraine. So that there's just different presentations with different types of headaches. But I do think the most common type that actually the most common type of headache is a tension headache, but with women in this, especially if you're getting these cyclical headaches. So like if you're getting a headache a migraine every time right before your period, that's also often hormonal migraines that you're experiencing. And when I'm treating, it doesn't I know people are defined by the type, but we can do the same things. So the type doesn't necessarily matter. It doesn't define you in a way, because what we're doing is we're really just looking at you in a unique place. So if you're having a tension headache, don't rule that out, because you still are having to medicate. You're still taking potentially Advil or Tylenol. You still have this chronic inflammation that you're experiencing. So we want to look at that pattern too. So it's really just putting all the pieces together for individuals, but the presentation can be different depending on what your unique triggers are.
Mm-hmm. Yeah, it's really helpful to kind of get us talking about headaches. It's really interesting for me too, because I spend so much time not talking about headaches. So it's actually really interesting to kind of get into the weeds of headaches.
And generally, you actually, I feel like most people either, we all can get a headache at a point, but most people either get headaches or don't get headaches. It's often that's this chronic thing where you do live a long time with this pattern.
Mm-hmm. Well, and so let's get into that aspect a little bit, because in some ways, I feel you took the words out of my mouth, because it's kind of like some people do get headaches and some people, exactly what you said, and people who do get these headaches, they get them and they get them regularly. And they kind of, if you talk to them about it, it's kind of like, this is how long it's been, or they used to be more frequent and now it's still a thing where they're kind of always kind of ready for the next one to come, whether it's in weekly, monthly, biannually, whatever. It's a thing that happens to them. So in your work, this is maybe a question that can't necessarily be answered, but why do some people get headaches and others don't? Or you talked about some of the triggers being related to food sensitivity. So based on your work and your experience with clients, what are some of the reasons why you think some women are getting these headaches and other women are not?
Yeah. So we'll kind of go through each reason. But we can start with genetics, because I have heard people say, oh, I have the headache gene. And so I said, well, there's not actually the headache gene, but what there can be certain genetics that set you up for different processes within your body. So I'm just going to give you, we don't need to go through all of them, but for example, there is a genetic variant for an enzyme in your gut that breaks down histamine, called diamine oxidase. And so you can have a genetic mutation in this DAO enzyme that can make you not able to break down histamine as well. And so foods with histamine can trigger migraines. We know that statistically. And so a lot of histamine containing foods can be foods that are good for you. So let's use avocado. There's a lot of people now more eating avocado because it's good, saturated fat, but avocado can actually create more histamine in your body, which can potentiate headaches. So there also, it's all this roundabout, but there can also, more histamine can make you, there's a cyclical element of histamine and estrogen too. So estrogen dominance, which we'll get into with hormones, can be another reason that you have headaches. And so when you're having high histamine, could be creating more estrogen dominance, which is there's different components that can be forcing this. So you can go back to that and think, okay, somebody, you may be able to eat histamine foods and have no issue. And I may eat histamine foods, and that is creating this histamine intolerance for me, which can potentiate migraines. So we can start there with genetics, and everybody's genetics are different. Then the two, I like to kind of just give people two easy things that they can start doing right now, because I think that's like, everybody's like, okay, well, what do I do? What do I do about it? So, we do know that dehydration and lack of sleep are simple, free things that are migraine triggers. And so I like really just going back to the very basics, make sure you're hydrated. So make sure that you're drinking, the roundabout measurement is about half your body weight in water a day. You also want to, particularly when it comes to headaches and migraines, be getting hydrated at a cellular level. So you want to make sure that you're sipping your water.
I just want to interrupt you for a second. Half my body weight in water. Do you mean like in ounces?
In ounces. I'm sorry.
I'm thinking like, am I supposed to? I know you did not mean I'm supposed to be drinking 70 pounds of water.
Yeah. Thank you for, no one drink that much water. That's too much. You can actually have too much water. So we don't want to do that. But yes, in ounces a day. So that's just kind of like a roundabout way to sort of gauge the water intake. But you also want to make sure that you're staying hydrated at the cellular level. So you want to make sure you're drinking water throughout the day. Sometimes when we gulp it all at once, we're just excreting it because we're getting so much at the same time. And then you also want to make sure you have enough electrolytes so it's getting absorbed. And so there are things like that you can do to increase your hydration. And then sleep is another thing. So we do know that there is an association with lack of sleep and migraines. And that's something that we just have to kind of put a mirror up and like, are you prioritizing sleep? Are you really getting enough sleep? Are you getting good quality sleep? And sometimes we aren't in our world today that we can be busy and we have things going on and we're just not maybe getting enough sleep. So those are just two places to start that are very good foundational places that you can start to look at, okay, how am I foundationally getting these things in?
But yeah, so I think all those things are really interesting. So I was taking down some notes and making a little list. And so I feel like to set like my understanding to summarize what you were saying, some of the most common causes the first thing you had mentioned earlier was the food sensitivity issue, which does make sense. And I think if anyone who's listening has ever worked in an office, I feel like there's always that one person that's very, very sensitive to all the scents and all the smells and all of that kind of stuff. And those people are kind of the canary in the coal mine. And I know that can have to do with genetics as well, predisposing people to different sensitivities and things like that. But that was something I also thought of, food sensitivities, but also sensitivities in general to scents and smells and all different kinds of things. And genetic causes, you mentioned issues with the DAO enzyme and being able to process histamines. So histamine overload then is associated with all these problems, and that can play into the menstrual cycle because often women have issues with histamine, also have issues with estrogen kind of triggering more histamine. And that would be potentially that cyclical issue because we have the most estrogen as we approach ovulation, et cetera. So that could kind of play out I think that's when you understand it through the menstrual cycle lens, having headaches around that ovulatory phase in particular and feeling kind of crappy around that particular time of the cycle can be a real indicator that it's related to hormones. And then you also mentioned the sleep problems in general. I think many of us have experienced not getting enough sleep and getting a headache as a result of that, and dehydration. So I think we have a nice, at least starting point for what are some of the common triggers for this.
Yeah. So foods can be a little bit complicated. So we want to look at histamine foods. We want to look. So I mentioned food sensitivities. And the thing is that you can get a food sensitivity reaction 4 to 48 hours after the food. And that can make it very difficult for people to identify because you're not necessarily getting the headache right after. You could get the headache the next day. And then what did you eat the day before? And some of those things, looking at the connections. So those are individual. So we can do testing, elimination diets when people that I work with to really dive into that. And then there's also foods that we know, like histamine containing foods that contain tyramine, which can be like aged and cured foods. Some people can be actually sensitive to foods that have salicylates, which are citrus. So you're not thinking maybe when you're having a glass of lemon water for detoxification in the morning, that could actually be something that for some people can trigger headaches. And then we have like MSG, aspartame, even caffeine is, you can actually treat headaches with caffeine, sometimes with the pain, but you can get rebound headaches from caffeine. So it's looking at all of these things and then, actually figuring out which ones are triggers for you. The other aspect is sometimes there's a threshold. So sometimes people can tolerate a certain amount of the food, but they go over that threshold and that's what triggers the headache. So you could say, I use wine a lot as an example because wine's a common one that people get, can have a glass of wine and get a headache, but then people will have a glass of wine and not get a headache and say, well, it must not be wine. Wine must not affect me because I can sometimes drink it. But maybe it's how much you drink, or the combination of having some wine with some aged cheese that's sitting out at a party and that has tyramine in it, and the overload together is what put you over the threshold to get the migraine. So I say we just become health detectives. You become detectives of your own body when you're looking at all of these things to kind of put the pieces together. And when you work with someone, you get a roadmap. I mean, I think that's the advantage is there's roadmaps we can do to kind of make it simple for you.
Yeah, because there's a couple of questions I have before I ask I'll just keep kind of going here. Sure. One of the questions that came to mind is about age. So do you find that this changes as women get into that kind of premenopausal, like from 35 to menopause age? Or do you find that it kind of doesn't matter? Like are 20-year-olds dealing with the same kind of issues? Like, is this completely unrelated to that kind of shift in the hormones as we get older? Or do you find that it changes somehow as we get into different stages of our reproductive lives?
Yeah. So I think it gets worse in perimenopause because we get more imbalance of hormones. So when we talk about hormonal for many women. I mean, it might not, but for many women, it gets worse because when we look at perimenopause, we have that drop in project. So let's take one step back. So the two most common causes of hormonal migraines when it comes to hormones are estrogen dominance and a rapid change in hormones. So when we're going through perimenopause, often we start to get that decreased progesterone before our estrogen actually drops. So it can make a lot of women who weren't estrogen dominant before fall into these symptoms of estrogen dominance because of low progesterone. And it's just a natural phase of life, but it can throw havoc on you. And then also as we're aging and our body's still trying to make estrogen from the ovaries, we can sometimes get like bursts of estrogen and then not, and bursts of it. So it's not just like decline, like in this nice, easy pattern. We go through a lot of havoc in that time. So I feel like in the perimenopause phase, generally they can be worse. Now, once you go through menopause, you can still get migraines then, but generally speaking, they're not quite at a lot. Sometimes people can actually find relief because their estrogen levels are lower and they're not, we're not getting this imbalance. Does that answer your question?
Yeah, it does. And I didn't want to make the assumption, but I did think to myself, well, it's probably going to be worse around that time if you are experiencing it, just for the exact reason that you said, because of the hormonal shifts and changes. So I think the big question that I have, that I think any of the listeners who are dealing with migraines would have also, is it actually possible from that functional medicine standpoint to eliminate migraines? I mean, maybe everyone isn't going to get the migraines eliminated, but is it possible to eliminate them? And if it's not possible to fully eliminate them, is it realistically possible to significantly reduce the frequency or the severity?
And that's what I think is so exciting, because yes, it is. I have worked with people. By the time you get to me, sometimes you've been dealing with this for a long time. You've tried most of the people I work with, I'm not their first step. They've tried other things. They've been living with this. And, I've had people that have tried everything and been having these consistent migraines for 5, 10 more years that actually are migraine free. I mean, so that's when we cheer, because like there's something, you can get to the point where it's just like, okay, they're gone. Now, I mean, you can't say that everybody can't have a headache at some point in their life, because every day is different and you could be exposed to something that triggers you, but you can't, I definitely see pretty much everyone. I can't say that that they actually see a decrease in both severity and incidence. So you see this dramatic decrease in incidence and severity, and there's often a total resolution too. And it does take, but I am going to say it takes time. It's not something that happens overnight where it's like, okay, we're used to the fast-paced world where you're like, okay, I'm taking a drug for that pain. It's going to go away. I want this gone. It takes time. Your body has to actually, we have to figure these things out. Your body has to heal. You have to get back in balance. So I think if you're getting regular headaches, it's worth it to try to investigate and take the time, because it can make such a dramatic change in the way you feel.
Mm-hmm. In my mind, I just keep thinking of the parallel to period pain in so many ways, because it's a similar kind of thing. I mean, when you're taking drugs, you get that. Ideally, you get that. I would imagine it's similar with migraines. So you often get that kind of fix where it goes away, but there's a window where you have to take the drug. And if you don't take the drug in the window, it probably doesn't work and you have to deal with the pain. I feel like there's quite an interesting parallel between these two issues. In the same way, many women would feel like, okay, this is just something I have to deal with. I've had them forever. So it's become part of their identity. Maybe their mother or their sister also has migraines, or their cousin, or it's in the family or whatever. So they kind of just assume that this is just how it is for us. So I think that in and of itself is a barrier for a lot of people, because they're not even thinking about the possibility that it could kind of be improved or relieved. They're just in there for a different reason altogether. Yes. And they might not even know that the reason that they're in there in the first place is related to the migraine, because it's often related to the hormonal problem. So maybe let's dive a little bit deeper into the hormonal aspect of migraine. So talk to us a little bit about what your experience has been, even what some of your clients find, especially with our audience. I'm sure they'd be interested in to hear some of the cycle connections with that. And some may have probably experienced that, where they're getting It's interesting though, because women will often have migraines in relation to their cycle, but they may not even be thinking about that until you
Yes.
bring it up. And then they start to track it and see that, oh my goodness, look at that. The majority of my migraines are at this time of the cycle or at these 2 times of the cycle. And I never even thought about that before. And where you start, from a hormonal standpoint, where we start to kind of improve some of those things.
Mm-hmm. And so I agree, because we're not always tracking our cycles. So we're just thinking, okay, I'm getting them. Now, everybody's different, but the 2 most common places that you're going to see the hormonal migraines are at ovulation, because of the rapid rise and fall of estrogen when we're ovulating. And then the week before, in that PMS window, right before your period. So I do see people that do have them, during menstruation or different times, but those are the 2 most common. And as we talked about, because in ovulation, your estrogen is rising and falling rapidly. And then in that week before your period, your progesterone and your estrogen are decreasing. But if your progesterone's lower than your estrogen, you're going to be in that estrogen dominant place. And so that's the common time that we see them. So for me, I do testing. So I will do hormonal testing. And what I like with people that I'm working with headaches or with migraines, both even, but to do a Dutch test, because with a Dutch test, you actually not only see the estradiol and the progesterone, but you also see the metabolites. And something that I actually see commonly in people with migraines is that they do not necessarily have a super high level of estradiol. So if you're going to go just get your blood drawn and you're going to get an estradiol level taken, you're just going to get this one snapshot in your blood and look at that. But when we look at this Dutch test, we look at the metabolites. And what I will see happen commonly is that you have a okay level of estradiol, but you have high metabolites. So we need to process our metabolites down this pathway called CYP1A1. And that's kind of where we want a lot of our estrogen to go. And that's how you excrete it. So when you think of estrogen, you want to use it and lose it. I always say, because you want enough estrogen for the purposes that we need estrogen in our body, but you don't want it hanging around. You need to be able to clear it or you're going to get these symptoms. So you get these high metabolites because people aren't clearing their estrogen. So you have 2 phases of metabolism of estrogen, and you probably talk about this. So I'm sorry if I'm repeating things that you're telling you, that everybody probably knows this, but you have 2 phases of metabolism in the liver and then, 1 in the gut. So we need to make sure that we're getting the estrogen metabolites from our liver and excreted. So when we're looking at these pathways, if they're not going down the correct pathway in your liver, then they hang around. And so we often have to do things to help you get them down the right pathways and actually be able to methylate them and excrete them from your body to optimize it.
Just popping into today's episode to invite you to join my Fertility Awareness Mastery online self-study program. If you're looking for an informative and comprehensive DIY option for learning fertility awareness, I've got you covered. This program is the most comprehensive fertility awareness self-study program available. And the best part is you can learn at your own pace in your living room for a fraction of the cost of one of my live coaching programs. Head over to fertilityfriday.com/mastery for details. That's fertilityfriday.com/mastery. Now let's go ahead and jump back into today's episode. Well, I would say that people may have heard the terminology, but the average person couldn't describe like phase 1 and 2 detox of estrogen and those kind of things. So I think there's always room to have those conversations. And so from what I'm understanding of what you're talking about, and also from my own knowledge of it, when we make estrogen, our body then has to break it down. So when you're talking about metabolites, there's going to be metabolites, but the question is, which pathway is the estrogen being metabolized? There's one pathway that leads to like fibroids and estrogen dominant conditions and cancer. And there's another pathway that's more optimal that we would prefer it to go down. And so it sounds like you're saying that, for a lot of your clients, when you're doing this testing, you're seeing that it's not being metabolized down the preferable pathway and that potentially they have issues clearing that estrogen. So instead of it coming out, where does stuff come out? We poop it out, we sweat it out, right? Like we pee it out. Like, where does it come out? If it's not coming out, if we've got gut problems and all kinds of other issues where it's not actually being eliminated, then it can keep recirculating. So that's my paraphrase of what you said.
Mm-hmm. So, and sometimes these metabolites that are recirculating, they can even have stronger estrogenic effects. So you're getting these estrogenic effects from the metabolites that are not being cleared from the body. And the reason that is important when you're looking at testing, so because sometimes when you're just getting a simple blood draw of estradiol, you're not even seeing that. So you could you could go to your practitioner and say, I want to have my estradiol checked. I want to have my estrogen checked. You get a blood draw that shows, and it may say, oh, your estrogen's normal. I mean, that's a whole nother conversation we could have with normal versus optimal when it comes to blood work. We want to make sure that they're optimal too, because we have really wide ranges when we're looking at normal conventional lab work, but we could see that it's normal, but you still, even in that, may have these high metabolites that you're not clearing out. And so then that can be a problem. So, one thing you can do, because I think always on podcasts, you want to know what you can do. So you can actually increase your intake of cruciferous vegetables. So cruciferous vegetables will naturally help move your estrogen down that CYP1A1 pathway. And that's something that everybody can do. You can eat broccoli, cauliflower, cabbage, Brussels sprouts, things like that. That's somewhere just to get started. The other thing I really would recommend to do is really cut back on your endocrine disruptors. We're exposed to so many things in our environment now that can disrupt our endocrine system and our estrogen. And so we want to look at things that are in our products. Your skin is a giant mouth. You're absorbing what you put on your skin. So if you're eating organic and then putting things on your skin that have endocrine disruptors, you're still getting exposed to some of these things. BPA is one that is in plastic that I think is actually a big deal to mention, because we're actually often putting our food in plastic containers, and then people are heating them in the microwave or the dishwasher when you're cleaning it. And then that can actually break down the composition of the chemical, and it can leach into your food. So then you're getting that from the containers you're actually putting your food in. So like switching to glass containers can just be a simple thing to do to actually help you. So I know it can feel overwhelming. So I usually just recommend to do one thing at a time. Pick one product. When you're done with that product, switch it to something cleaner. And you can go to ewg.org Skin Deep site and actually see the rating of each one of your products, which is a nice resource for people to be able to use.
Well, I really appreciate the practical aspect. There's so much that's coming to mind, I think, pertaining to everything that you just mentioned, changing some of the things that you're eating more cruciferous vegetables, and addressing the endocrine disruptor xenoestrogen conversation. I love what you said. Your skin is a giant mouth. I wrote that down.
Yeah. Well, it's true.
I will
we
probably be saying that again.
Yes. Okay. No, you can go for it. Yeah. Because, we're thinking about it we think about organic foods more and more now, which is wonderful. So you're thinking about your food and what you're eating, and that's so important. But then we're not always thinking about all the products that we use that are also being absorbed into our body.
Well, and there's something related that I wanted to mention, the term estrogen dominance. So I find that term is thrown around a lot, to the point that I get these messages from women who they say things like, I think I have estrogen dominance. It's like a condition that so my understanding of estrogen dominance may be a little bit different than the average person because of my background and history with menstrual cycle charting and just my training as a fertility awareness educator, etc. Because my understanding of estrogen dominance isn't that it means you have high estrogen. It means that you have more estrogen in relation to progesterone. That's how I understand it, or you have issues clearing it, like you were talking about. And I think that's a huge misunderstanding. So all these women think they have this estrogen dominance, like they've got this high estrogen. They can have low estrogen and still have estrogen dominance.
And that's what I see. That's what I was saying. I see that regularly, where you're not having, it doesn't mean that you have these astronomical, off the chart estrogen. That's actually not as common, to be honest, that from what I see, that, that there are super overall high levels of estrogen. There's often low progesterone or higher metabolites where, you're just not clearing it. Mm-hmm. So yes, I agree with you.
It's just so interesting. And from when you talk about what to do to improve it, it's not sexy. It's not exciting. I feel like when you're talking about let's change up the containers and let's organize, this is the kind of stuff I talk about. And when you're having these conversations, I imagine that to some degree, people's eyes roll over because they think to themselves, you don't understand. This is causing me a lot of stress. I have these migraines. I need some sort of supplement. I need a medication. Tell me what to take. And I feel like, a huge part of this, it's going back to what you said when I asked if this is something that could be improved. And you said yes. And you said, but it's not instant. And so it takes these kind of lifestyle shifts, incremental, little by little, to stop bombarding ourselves with all of this chemical soup that makes our hormones worse, to improve the way our body functions.
Yes.
And then to support our bodies to have hormonal balance. There's so much improvement that can be had by these non-sexy, non-instant things that can be done. And I'm curious, we touched on the food sensitivity piece of it. Did you want to just talk a little bit about the approach that you take with your clients regarding, identifying food? There's a whole conversation that could be had about testing and how when you test for things, a lot of things show up, and there's a conversation about how accurate that is versus doing an actual elimination diet. And I mean, we don't have to go into a ton of detail. We only have a couple minutes left, but
so I think that's a good point. There's a lot of confusion around food sensitivity tests. So I would say if you're going to look into food sensitivity tests, find a practitioner that you trust to do it, because I have done a lot. So there's two different theories, which, some people just say, okay, do the elimination diet. And for some people, that's great. Other people, it's really difficult to do in their life. But the one thing that I find that happens when you just say, okay, just do the elimination diet, is I see people, you may be allergic to peas. Sensitive. They're very different. We could get in, that's going to be a whole nother conversation. You can be sensitive to peas, and you're eating pea protein every day because you're trying to stay away from dairy, and that's your food sensitivity. So without testing, sometimes you could miss the mark potentially. Now, that being said, there are a lot of food sensitivity tests out there that may not be accurate. So that's why I say go to someone that you trust, that you're going to get a test that they trust, because I've done comparison side-by-side tests on myself, just because I always want to get the best deal for people. If there's a test out there that I hear that like, oh, okay, this is great, and it would work, then I would, recommend it, but you can see very different results. So not every food sensitivity test is created equal. So just be careful when you're, looking into that you're kind of going through that with someone that you feel comfortable with and can trust that they've looked into it and have done research on the test.
Well, and this is a big topic, so it'll be the high level overview. I find that what's interesting about this whole food sensitivity conversation, I think it is really important to identify the foods that you're sensitive to. And for a time, depending on the sensitivity, your reaction, it is, I think, helpful for most of us to remove those foods for a period of time. Tell me what you think about that, though, because I feel that I've worked with a number of clients who, let's say they have some food sensitivity, so they are removing certain foods. And then they work with a practitioner that tells them to go on a low FODMAP diet. And all of a sudden,
there's so many. Yeah.
And
Yes.
I'm not going to go into the FODMAP thing. You can do search online if you want to do that, because everyone has a computer right at their hands, right? So search FODMAPs if you've never heard about that. But basically, it's a whole long list of foods that contribute to a different challenge. But my point is that I have worked with people who get to the point where their list of foods they can eat is so small. And it seems that they're often under the impression that they have to kind of take these foods out forever. So that's a whole big conversation. But just share a little bit about your approach when it comes to migraines and cutting out these foods. Like, is there a point where you're reintroducing, or how does that work just generally?
Sure. And if people wanted, I actually have a podcast called A Little Bit Healthier. And episode 3 is actually all about what a food sensitivity is, how it's different than the allergy. I do a deep dive into like the antibodies, the half-life, all of that. So that you can, if you want to know,
we'll definitely link that to this episode.
If you want to go deep, you can listen to that episode, because it really defines all of this. And because it's a little bit hard to understand the difference between a food allergy, a food sensitivity, how you do all of this. But I recommend 90 days generally speaking. And that is because, and then you reintroduce actually. So you don't stay off these foods forever. I do have people come that were like, I did a test 10 years ago and I have a sensitivity to eggs, so I don't eat eggs. I'm like, well, you probably don't have a sensitivity at this point because you haven't eaten eggs for 10 years. So try them, put them back in and we'll see. But generally these food sensitivities are an IgG antibody. And those happen because you get intestinal permeability then those foods are coming through the lining of your gut. And so we're getting this IgG antibody response. So once we heal the gut, we heal the lining, we pull that food out, we can generally actually add it back in. We say 90 days because of the half-life of the antibody and to clear them out. And then you add it back in one at a time. You see if you tolerate the food. If you tolerate it, you add it back into your diet. If you have a reaction, then you pull it back out for another 4 weeks and then reintroduce again. So these are not foods that need to be eliminated long-term, but your body just does need a break for them right now to decrease those antibodies.
See, I mean, there's so much more to know about this. Anyone who's listening can appreciate that we could have a conversation. You could do a class on
I
this
know,
stuff
yeah.
and do like a weekend seminar or do like a 4-month stint in. So we're just getting into a little bit of it, but these are some of the things that I want the listeners to take away, because I think because a lot of us do get information in this format. So we're getting chunks of information here, chunks of information there. There is, because we don't often get this type of support from our medical practitioners, you basically have a lot of women who are trying to sort this out on their own. They have functional practitioners. And what I always suggest is, when you're searching for a functional practitioner, like a functional medicine MD, medical doctor, or if you're searching for a naturopath or someone like that, to find someone who specializes in the issue that you're facing. Because no matter what kind of professional that you're going to, if they're not specializing in your specific challenge, you might end up kind of having a more roundabout experience to getting to the information that you need. But some pieces of information, especially related to the food sensitivities, because there's so much discussion around that, that's something I see a lot where people do seem to think that they have to get rid of these foods forever, and that's just not conducive. A lot of the clients I work with have a future goal or a current goal of conception. And when you're trying to have a baby, you want to be able to incorporate foods that are highly nutrient dense and things like that. So if you're completely eliminating dairy and you're completely eliminating 20 different foods because of something you're doing, it's hard to meet both of those types of goals at the same time. The goal of the gut healing and the goal of getting the optimal nutrition for the particular stage that you're at.
And the goal should never be a long-term elimination, especially of nutrient-dense food. It should just be really targeted to your specific needs. I like to think that you actually have more food flexibility once you have the knowledge around the foods that do and do not serve you.
Mm-hmm. Well, I mean, we've gone in a number of different directions today. But I feel like if we bring it back to migraines, what I'm thinking about relating to all the different avenues that we've gone to is that a lot, or at least a large percentage of this issue of migraines is related to a lot of these issues that we talked about today. Yes. And it can be frustrating even if you tuned into this episode to think like, man, I just wanted to help with my headache. And now you're telling me I have to. Yes. But I think if you understand that root cause, no one said it's going to be easy. Like there was nothing about this podcast where we're like, yeah, this is super simple. You just that was not the point. Mm-hmm. But lasting health comes from figuring out these root causes and taking some time to sort it out. So if you were to kind of summarize, or for the listener who is dealing with headaches and now they're kind of like, wow, I had no idea that it could be related to all these things. Where do I start? Or, what are some of the kind of final words or takeaways that you'd want her to know?
Yeah. So I actually have a free guide. So if you go to helpmyheadaches.com, there's 8 steps. So that would be a great place to just start. If you're like, okay, I've been dealing with this for a long time. I'm ready to start. I want to make some of these changes. There's steps that you can start in there. There's actionable tips. There's help. So that's a place that you can, like I said, it's just helpmyheadaches.com. So it's pretty easy to find and you can go there to get started. Now, if you start those things and you're like what we're talking about, you feel overwhelmed, you need guidance, then, I do have a program called Headstrong, where I run it a few times a year with a small group, and I work individually with people too. You could find someone that can give you the roadmap, because that's sometimes having, like we're saying, all of these things, but is there a roadmap that makes it clear, simple, easy in getting the testing that you need in order to get some of the pieces together? So, but you may start those steps. And for some people, there can be very simple things that they make changes with and just see this huge difference. Other people, it's more complicated. I actually had 2, I know we're wrapping it in, but I had 2 sisters that started with me at the same day. And one within, both of them had been getting migraines since they were 15. They're like, okay, we're going to do this. Within 3 weeks, one completely had no migraines anymore. They were just, we did, got the right nutrients in her. We got everything set up, and they went away immediately. And the other sister's sort of looking at me thinking, she didn't say it, but probably thinking, well, why is she fixed and not me? But, it took her about 3 months, and then the same thing happened for her. But it was just so stark because they were sisters. They both had this problem, and it was just a different path. So sometimes starting with simple things can make a huge difference.
Mm-hmm. Well, I had this thought earlier, so this is a good time to put it in there. When we go through these kinds of things, even when we went through some of the contributing factors, we all know people who do all the things. They drink all the alcohol, they eat all the food, they don't necessarily sleep good, they drink coffee like whatever it is, but they do all the things and they seem to be fine. Like they don't get the migraines. And so it can feel really unfair. Like, did I just draw the bad lottery? Like, why is it that I have to work so hard just to not have a headache kind of thing? And unfortunately, that's just how it is. Like, there's no other way to say it. When I'm in my work with menstrual cycle charting, it really shows the individuality. There's a lot of common threads that we need to do to be healthy, I think, but there's clearly different sensitivities. And some of us just have a proclivity for one thing or another, whether it's period pain, migraines, or whatever the case. One thing I just want to say on air with regards to this episode that we did not talk about is the whole pill scenario, and how if you did have migraines before the pill and you go on the pill, that can worsen it and give you a higher risk for stroke and stuff like that. So if this is new information, if you're a brand new listener, I would suggest, going back and listening to some of the Pill Reality series episodes. Or I just want to say that we don't have time to go into it.
Yes,
but I just want to say that because
does not
for some women,
your hormones. Yes.
Yeah. And if you're on the pill and getting migraines, that's a problem. And your doctor may not have told you that maybe if you have a migraine with aura and you take the pill, you should come off the pill, but that's a very serious contraindication that you should be aware of. So my apologies. Maybe in my wrap up, I'll talk a little bit more about that, but I just wanted to actually say that on air because a lot of women do get migraines and a lot of doctors tell women to take medication, and they're not necessarily screening these women to see if they're also on contraceptives. Like, that's not a thing that happens.
Yes.
So the public service announcement over. Dr. Mill, thank you so much for being here. This episode was really, really informative, and I'm really glad we were able to delve into this topic together. Maybe share with us, you shared the resource, you could share that again, but share with us your website, your Instagram handle, and just kind of let us know all the places about your podcast and all the good stuff.
Yeah, thank you. So I have a podcast called A Little Bit Healthier, and those are things you can do every day in your life to be healthier. I feel like we just need to have those tips. So I have that every week. And then I'm over on Instagram at Dr. Meg Mill. And again, you can download that Help My Headaches guide to get started today. So thanks for having me.
Awesome. Thanks so much for being here.
Thank you.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/455. I hope that you enjoyed today's episode with Dr. Mill. What an interesting topic that affects so many women. And what's interesting about headaches and migraines in particular is what a large percentage of them are associated with the menstrual cycle. It's the majority of headaches, especially recurring headaches women experience, are somehow associated with their cycle. And it's also interesting that until many women start tracking it, they may not really notice how much of a correlation there is. So obviously every single headache is not directly correlated with the cycle, but the vast majority are. And by balancing hormones and maintaining overall health, a significant improvement can be seen for many women. So it was really interesting to listen and learn more about Dr. Mill's approach in this area and how beneficial that can be, especially for women who don't even think that this is a thing that could be improved. So with that said, I hope that you have a wonderful weekend whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting.